Right now we're going to hear a few voices from people who want to tell you about the work that we do. So again, this is Dr. Lederman. We'll be back in a moment, and give us a call if you want.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hi, we're back, and hope you are doing well. We had a man who came in, actually an Irish origin man. He was born in Ireland, moved to the United States. He's about 80 years old. I tell you that because he has a squamous cancer of the face, and many Irish people have very fair complexion, and fair complexion people tend to have more skin cancer. So it's a warning, especially on a weekend like this, to put on the sunscreen and your hat and your shirt and cover up a bit more than you otherwise would. Anyway, this man came in with a squamous cancer of the face, and it was very extensive. It was from the cheek on the left side all the way over to the ear, involving the ear, the cheek, and part of the eye area. He saw surgeons who wanted to remove half of his face, and he went to one of the big hospitals. The surgeon wanted to do it, and when he got to the hospital, apparently they had some kind of screening committee that they wouldn't let him cut off his face. They wouldn't let the doctor cut off his face. And he found out about us. I was treating him 20 years ago for prostate cancer, and he's cancer-free 20 years later. So I know a lot of people think, wow, if you have cancer, it's never cured. This man, 20 years later, he's cancer-free, and he's happy, and he called me because we treated him successfully 20 years ago. So we started treating him in June, and he got halfway through the treatment, and he's coming from Staten Island, and it's a long commute, and it's 80 degrees outside, and he's 80 years old, and he said, to heck with it, I'm not doing this anymore, and he quit right in the middle, which is not a great thing to do, because the treatments have to be finished. You can't just stop in the middle. Anyway, he stopped in the middle, and then he came back. And it was shocking to everybody because he was so angry that day. I don't know, he must have had a bad commute or a bad bus. But he came in, he said, Doc, will you please finish up your treatment? It's really looking good. And the answer was yes, of course we'll finish up the treatment. We were hoping he would change his mind as the cancer shrank. And most of the cancer is already gone, even though he's only had half the treatment. So we're very hopeful that the rest of the cancer will go away. It's not a good idea to break up treatment like that, but nevertheless, he's doing very well. The cancer is dying in front of our face. His ear is back to pretty much normal. There's, I would say, 90% improvement in the cancer. So he's happy. Our staff was happy to see him back, and he is really happy. He is motivated. He does not want to get his face cut off. Wow. And we had a woman come in this week, 67 years old, married with 2 children. She had a golf ball-sized mass in the right breast. She came in at 3:30, so towards the end of the day, and nevertheless, I sat down with her and sat down with her husband, and we even hooked her up. We got her hooked up so we could get her scanned, and we could get a little needle biopsy. We see many women who have breast lumps and breast cancer, and for whatever reason, they've been afraid of having mammography or afraid of having pain. And I told her, like I've told other women, like we've talked on this show before, that we have a team together, where we can actually put a little needle in that breast without pain. We can numb up the area. It's a tiny little needle, suck out some cells, and most likely give you a diagnosis. So most likely we can give you a diagnosis. And for this woman, we put the needle in. It just happened 2 days ago. She'll be back on Monday. She'll have her answer. And then we'll stage her up. We'll probably do one more test to stage up if it's cancer. And she'll know exactly what she has, where she had it, and she'll learn all her options. So if you do have a lump of cancer or do have a lump, whether it's cancer or not, I know some people have lumps. They know it's cancer but have declined therapy. We see women like that. And occasionally men, which we'll talk about later in the show, or just a lump that you don't know what it is but you're suspicious. Give us a call, come in, and we'll talk about a way to try to get you worked up, pain-free, so you know what you have. If you don't have cancer, it would be great to know that it's not cancer. If it is cancer, it would be great to do the right thing, hopefully to get you into remission. And there's just a study reported this week, which I wanted to share with you. It was published in Radiology by Milgram, and the bottom line of the study is that there's an improved prognosis in older women who have mammographically detected breast cancer. So women who have mammograms have an earlier stage of cancer, so the cancer is smaller than when it's detected by the woman or the physician themselves. And we're talking about women 75 years or older. So the last woman we had was 67, a bit younger than this, but I'm talking in this study about older women, 75 and up. The value of mammography has been subject to a lot of debate. The American Cancer Society recommends annual mammography for women 75 and older as long as they're in good health. And remember, that woman who's 75 or 80, she's more likely to make it to 100 than most of us. She's already made it through childhood diseases and war and combat and car accidents. She's at 75 or 80. So why withhold treatment? Doesn't make sense. I just had a man come in at 90. He looked like he was 70. So lots of people are in great shape. This is one of the early studies that looked at mammographically detected lesions. They're at earlier stage than if the doctor or the patient finds them. The prognosis is better. Often can be treated with lumpectomy, just remove the lump, and radiation for cure. And in fact, guess what I'll tell you. It's a 97% success rate. If you mammographically detect a breast lesion, the success rate 5 years later, being cancer-free, is 97%. It's pretty good. Pretty good. So think about that. Give us a call if you want to be seen, if you have a breast lump, if you want to hook up with mammography. It's the right thing to do. And we had another man who came in for follow-up, kind of the good news department. He's a younger man. He's about 55. He has a neuroendocrine cancer of the liver, and we do treat a lot of liver cancers. We have a caller, so let's just take this call. Good morning. You're on the radio.
called and received the DVD and the paperwork, the brochure.
Okay, what's your question today?
I just wanted to know if she's going the right direction for what she has.
Well, you're on the radio, and there's 50,000 people listening, so why don't you call during a normal time off the radio, and then we can talk about her case privately, if that's okay with you.
Oh, no, that's fine with me. I just didn't know whether I should be on the radio or not in order to speak with
No, I think a private question, is better talked privately.
Okay. When's a good time for me to...
Later in the day. You can call when you're comfortable, but let's talk privately if that's okay.
All right, so it's good to be like after 11 o'clock today?
Something like that, or a weekday, whatever is good for you, okay? Anything mutually convenient.
I'm going to call today. All right.
Thank you. God bless you. Bye now. So for this man, he had a neuroendocrine cancer of the liver. Other treatments didn't work. He came to us and had radiosurgery, which is pinpoint treatment just aimed at the cancer. 5 treatments. Each treatment takes about 15 minutes. Again, radiosurgery is non-invasive treatment. No cutting, no bleeding. Come in, get a treatment, and go about your business. Again, for this woman who called, she wanted to know about her sister who has cancer, and so obviously we don't like to talk about private issues, about people on the radio. But if you have a private medical question, you're welcome to call us at 212-CHOICES. 212-CHOICES. Do that after the radio or during the week or a time that's convenient for you. If it's urgent, obviously, call anytime, even 5:28 in the morning, if it's urgent. We have another man come in, who is 61. He's a black man. Why do I say it? Well, he was diagnosed 3 years ago with very high-risk prostate cancer. What's high-risk prostate cancer? Well, it's when the PSA is more than 10. So actually 3 years ago his PSA was 8, and now it's 13. So over those years of no treatment, he's gone from an intermediate risk with a Gleason 7 cancer. Gleason 7 is how the cancer looks under the microscope. Elsewhere, he was advised to go through robotic surgery. Well, if you see robotic surgery for a Gleason 7, PSA 13.5, the results are dismal, and that's true for robotic surgery or for open surgery. Surgery is lousy treatment. If you look at our success rate, and we have a booklet which we'll be happy to send you at no charge, you can look at the data for robotic or open surgery, which has pretty much superimposable data. Robotic surgery has been a big disappointment for prostate cancer, with seemingly complication rates that are higher, worse sexual function, if that's possible, with robotic than open. And this is according to a study from Harvard that looked at men having open surgery or robotic surgery. So robotic surgery has not given men what they've wanted for prostate cancer treatment. I believe most men want to have a higher rate of successful outcome, to avoid radical surgery, to keep sexual life and urinary life. And I think when you add those 4 things together, higher success rate, better sex life, better urinary life, patients would come to us if they only saw the data, and that's why we provide the data. So just give us a call if you want the prostate booklet. It's available. Call us during the work week, Monday through Friday, at 212-CHOICES, which is 212-246-4237. 212-246-4237. Give us a call, and we will send you the booklet or answer your questions, or best yet is to meet. So we're going to stop for just a moment. We're going to have a word from our sponsor, and we'll be right back. Thanks. This is
Here's
Dr.
Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within 1 business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted.